All right, so this is our lab PowerPoint screening test of hemostasis. So now that we've talked through all the pathways and the factors, we're going to talk about what tests do we run in the lab on coagulation factors. So the very first slide here is a nice chart that tells us different tests and what factors are tested in it and which ones aren't. This is a great thing to refer to. The bleeding time test, this is a really kind of old-fashioned test, but basically this is the one where you put the blood pressure cuff on to set it to 40, and then it's a small incision on their forearm, and you sit there and see how long it takes them to stop bleeding. In this one, it's only assessing platelets and platelet function. So because it's a very minor small cut, it's only going to be the platelets that really are getting tested on this and how they're functioning. Our next test, PT, and we're going to talk more about these here in depth, but PT is going to test those factors that listed as positive. As you can see here, APTT tests those factors that are positive. TT is only going to test fibrinogen, or what's known as factor 1. And then urea solubility is only going to test factor 13. All right, so let's keep going here and get started. Again, these are going to be screening tests that we're going to first talk about. So they're just going to screen to see if somebody has an abnormality occurring in their coag system. If it comes up positive or it's a weird result, abnormal result, the doctor can then go ahead and order more specialized tests to figure out what's going on. So we're going to start with the very first one. It's probably the most common test ordered in the coag department, and it's called a PT, or what's known as a prothrombin time. You might also hear it just called a pro time. But our prothrombin time tests the extrinsic pathway. So it only tests those factors found in the extrinsic pathway. So when you look at the screen right before the slide, two slides before, and you look at that PT, and I tell you it only tests the extrinsic pathway, you can see that here. It's testing factors 10, 5, 2, 1, which are common, and factor 7. Those are the only factors found in the extrinsic pathway. 13 is its own unique little deal. 13 only can be tested by urea, so that's why we don't worry about that here. So again, it's just testing the extrinsic pathway factors, and you must remember that. So it lists them out here as well, but I wanted to kind of correlate it back to that chart, 1, 2, 5, 7, and 10. All right, so how does the prothrombin time test work? So let's talk a little bit about reagents. It is important to not discuss this. So the main reagent that's used is what's called tissue thromboplastin. Basically, this is going to act just like the tissue factor. So remember, in your body, when your extrinsic pathway starts, it starts because of tissue injury and tissue factor becoming exposed. Well, we're going to mimic that setting in the lab. When we get somebody's blood sample in, we run their plasma, and we're going to add in tissue thromboplastin that's going to act like the tissue factor, so that way it can get the extrinsic pathway started. So that'll activate the extrinsic pathway. We're going to incubate it. It incubates inside the analyzer. It's not like you have to take it out. There's like a little incubation area inside the analyzer. Then we're going to add calcium. Calcium is an important part to add because remember, you have to have calcium in order to have a clotting process occur. And because you're drawing these in a sodium citrate tube, right, light blue sodium citrate tube is the tube that we must use for coag tests. That sodium citrate binds calcium and takes it out of there. Well, we need to add the calcium back in when we're testing so that we can get that clot to occur. And so with the prothrombin time test, all it's doing is measuring how long is it going to take for this person to clot. How long does it take in their extrinsic pathway to form a clot? Most people should only take 11 to 15 seconds to form a clot with the extrinsic pathway. Our next test is APTT, also known as activated partial thromboplastin time. This measures the intrinsic pathway. So basically, it's almost all of our factors except for factor 7 and 13. Remember, 7 is only found in the extrinsic pathway, and factor 13 is just weird and only wants to be measured by urea. All right, so let's talk about the reagents here with APTT. The first thing that is activated is just what we call an activator. It's an activator reagent so that it can activate the intrinsic pathway and get it started. Also, we add in either a phospholipid or a calcium chloride so that we can get that pathway to have calcium and so that it can form a clot. Again, you're just measuring the time. How long is it going to take a person, their extrinsic or their intrinsic pathway to clot? And in this one, it's 23 to 36 seconds. It has a few more steps to go through, so it's a little bit longer. All right, our next test is what we call the TT or thrombin time. The only thing that this tests for is fibrinogen, basically. It's looking at how does fibrinogen function and how can it form a clot. So if you go back to that second slide with the chart here, and you look under the TT category, remember, it's only testing factor 1, which is fibrinogen. So I'm going to go back to that slide I was on. So we're measuring the conversion of fibrinogen to fibrin. You're adding thrombin to their plasma, and you're measuring the time it takes to clot. So if you have an abnormal or prolonged thrombin time, so somebody's result took way too long, it could be one of three little things here. It could be that you don't have enough fibrinogen, you're deficient or low in it, so you can't really form a clot very well. It could be you have dysfibrinogenemia. Basically, that means that you have fibrinogen, but it doesn't function right. It's not working correctly for whatever reason. So then you can't form a clot very well either. Or you could have an inhibitor present like heparin, plasmin, or some other stuff. But if you have an inhibitor present, that will also inhibit how that can form a clot. All right, so going to the next one, this is going to be very similar to the thrombin time test. This one is called the rectolase time. It basically is going to measure the same thing as thrombin time. It's measuring fibrinogen again. But in this case, we're using a different reagent. And because of that, this one is not sensitive to the effects of heparin. So when you look back, thrombin time was sensitive to the effects of heparin. It could prolong it. But in this case, it's not sensitive to the effects of heparin. So if you're worried that heparin contamination might be playing a role in prolonging somebody's thrombin time, they can use this test to make sure. So same thing it's testing for, just different reagents. All right, so we're going to go through a couple scenarios here, and I'm going to have you answer. So just now knowing basically what we talked about, what factors are getting tested in what tests, you should hopefully be able to help me answer these questions. So if somebody has an abnormal PT and a normal APTT, what factor is probably abnormal? Are you guys still there? Like, you're discussing. Okay, good. Then now I'm starting to wonder, am I talking to anybody? All right. I'll let you discuss a little bit longer here. Good. It is factor 7. And the reason for that is your PT is abnormal, so that's your extrinsic pathway. So right there, you could rule it down to just those factors. You have to know that it's one of those factors that's weird, and that's 7, 10, 5, 2, and 1. Your PTT, though, is normal, so it cannot be 10, 5, 2, and 1 because that's found in both. So it has to only be factor 7. That's the only one that's different than APTT. Very good. All right. So in this case, I'm going to ignore the small bullets underneath, but if you have an abnormal PT and an abnormal APTT, what factors might be abnormal? There's a few lists you could list. So just ignore the bullets underneath and just discuss if you have an abnormal PT and abnormal PTT, what factors might be abnormal. Awesome. So it's the common pathway because they're seen in both 10, 5, 2, and 1. Perfect. All right. I am going to skip this slide. I don't need you to have to look at that. All right. We have a normal PT, but an abnormal PTT. Now, in this case, I gave you the answer. Because just the APTT is abnormal, it has to only be the factors that are unique to the intrinsic pathway, which are 12, 11, 9, 8, pre-K, and HMWK. All right, so those were all screening tests. Now, let's talk about what we can do to confirm if there's abnormalities. What can the doctor order more? And those are factor assays, meaning you can measure the levels of any one of these factors. So if I want to determine how much fibrinogen somebody has, or how much factor 8 does somebody have, or factor 9, I can measure that. So that's what's meant by factor assays. We also have what we call substitution or mixing tests. We are going to talk about that more in detail here in just a second. And then we have the urea solubility test. Again, that's only for factor 13. So if the physician has some idea that, you know what, I really wonder if their factor 13 is out of whack, they can do that test. All right, so we're going to get into those substitution and mixing tests. It's the same name, so if you hear them called substitution or mixing studies, it's going to be the same thing. This is going to get a little bit more complicated, but hopefully you can stick with me. Let me know if you have a question. But basically, what a mixing study is that if somebody has an abnormal test result, an abnormal PT or an abnormal APTT or both, we can mix it with a substance. We can take their plasma and mix it with a substance and then repeat those tests to see if they got better. So let's look at the next slide here. If the test got better by mixing it, then the mixture has replaced what they were missing. So let's keep going here. I think it'll be easier when you see these substances that we can mix in. We're going to ignore the normal plasma here in just a second. But we can mix with a patient's plasma, we can mix in either a serum substance, the next slide lists the others, an aged plasma or an adsorbed plasma. And as you can see here, each one of these is listing factors that it contains and factors that it does not have. And it's basically like solving a puzzle. When you mix a patient's plasma with serum and rerun the test and it corrects it, meaning makes that test all of a sudden a normal result, we know that the serum has contained a factor that has replaced what that patient was deficient in. So in serum, they have the factors 7, 9, 10, 11, and 12. So it's missing all the other factors, which are these ones. So I always remember, and unfortunately, you guys have to memorize this. You need to know this not only for my tests and quizzes, but also for the boards. So you must know that serum has 7, 9 through 12. That's the way I remember it. And then aged plasma has everything except for 5 and 8. So I just remember that it does not have 5 and 8. So it has everything but 5 and 8. And then adsorbed plasma lacks the prothrombin group, which again is 2, 7, 9, and 10. You have to memorize that prothrombin group anyways. You might as well memorize that adsorbed plasma is missing it. And so it has everything else. So I am going to give you some case study-like questions using these mixing studies so that we can begin to try to solve these together so you can see how these work. On the next slide is a nice little chart that tells you exactly what would be yes or a no and what would be replaced. I don't want you to use this because it's kind of like cheating. You're not going to be able to have this on your exam or quiz. I want you to go just by knowing the serum, aged, and adsorbed plasma, what they contain. So I am going to upload here those questions. Just give me a second to find them. Okay, So let's start with our first one here. And then you're just going to type in your response of what factor you think it is, or factor is it could have more than one choice if it can't rule it down to just one. And then we'll take a look. All right, so this patient had a normal pro time, a prolonged APTT. When it mixed it with serum, it corrected. When they mixed it with aged, it corrected. And when they mixed it with adsorbed, it corrected. So the first thing that you should do is just by looking at your PT and APTT results, you should be able to determine what factors here are choices. So by having a normal PT and a prolonged APTT, you should be able to rule that down to a set of choices. And then go through and look at all three corrected, meaning serum, aged, and adsorbed, all had the factor in it to correct. So discuss it and let me know. Put in your response and submit it, and then we'll take a look at what your thoughts are. All right, so you guys say 11 and 12. Perfect. Yep, it can be either one of those. We obviously would have to do more work to determine which one it would be or get more information. But yep, you could have ruled it down to either one of those. That's great. Okay, let's do another one here. Prolonged PT, prolonged APTT, serum, no correction, aged, no correction, adsorbed was the only one that corrected. And again, don't cheat and use your chart at the end. All right. Factor 5 is right. Very good. All right, let's look at our next one. Prolonged PT, prolonged APTT, no correction with serum, it corrected with aged, no correction with adsorbed. I always think these are kind of fun to do. To me, they are like a puzzle, as long as you can remember what's in each thing. All right, let's take a look. And it is factor 2. Very good. All right, let's do another one. Normal PT, prolonged APTT, corrected serum, corrected aged, no correction on the adsorbed. Okay, let's take a look. And it should be factor 9. Awesome. So do you guys feel more comfortable with those kind of scenarios? You won't have them on the quiz next week, but they will be coming up soon. But I know that there's a group of you doing them, so I'm not sure if all of you feel comfortable or not, but does it make sense? And you're not using the chart at the end, you're actually using what you know? Awesome. Okay, so let's do another one here. This one's going to be, I'm going to just kind of help you with it. I don't expect an answer because it's a little tricky. But in this case, we have a prolonged PT, prolonged APTT, no correction with serum, no correction with aged, no correction with adsorbed. What that means is that they're not deficient in a factor because one of those should have corrected. What they have instead is an inhibitor. They have a circulating inhibitor. Something is messing up with the results of these tests. So that would be the answer on this one. If you ever to see this kind of case study, the answer would be a circulating inhibitor. So just so you're aware of that kind of a scenario. Okay, one more question here on this part. What would be the PT and APTT results if you had a factor 13 deficiency? So what would their results be for PT and APTT if they were deficient in factor 13? All right, let's take a look. Actually, they would both be normal because factor 13 isn't tested by either PT or APTT. It's only tested by urea solubility. So it's a trick question. All right, very good. So I'm going to go back to the PowerPoint because there's review questions on there as well. So I want to make sure we get through the rest of those review questions. Hold on one second here while I switch back over. All right, let's start with our first review question here. Here you can just type in your answer down in that box below. All right, a patient had a prolonged PT but a normal APTT. What is the most likely factor deficiency? And you have choices. Good, it's factor 7 because that's the only one found in ProTime that's not in APTT. Awesome. All right, the D-dimer test is a specific test for which? Excuse me. Close. It's not plasmin degradation of fibrinogen. So remember, D-dimer is a piece of an actual clot. So look again. Awesome. Yep, that's it. It's actually the plasmin degradation of the fibrin clot itself. But very close. Good job. All right. Which of the following factors is not present in the adsorbed plasma? Good. It's factor 2. Yep. So remember, adsorb plasma is missing the prothrombin group, which are factors 2, 7, 9, and 10. So, yep, out of these choices, factor 2 would not be found there. Good. All right. The integrity of the intrinsic system is evaluated by what test? Awesome. APTT. Very good. So remember, thrombin time measures fibrinogen. PT measures the extrinsic pathway. Like you said, the APTT measures the intrinsic, and bleeding time is platelet function. Okay? If a patient has a prolonged PT and a prolonged APTT, but both are corrected by aged and serum, but not corrected with adsorbed, what is most likely our deficient factor? Good. That was quick. Yeah, it's factor 10. Perfect. All right. The urea solubility test is specific for detecting deficiencies of factor 13. You're all over that one now. And an abnormal thrombin time is associated with which? Good. Fibrinogen deficiency. Yep. So an abnormal thrombin time would be seen with a fibrinogen deficiency or a dysfibrinogenemia or um, an inhibitor thing or an effect by like heparin or something like that. Very good. All right, that's it. The last slide is just references. I took some material from another hematology textbook besides their own for it. But other than that, that is the rest of the lab PowerPoint. Any questions at all? Anything that you can think of? They're thinking. Awesome. I'm actually going to stop the archive recording, and then I'll still stay on though for so we can discuss the lab. I'm just going to stop the recording.